Hi everyone, I'm Heather Wen. I'm a retired nurse practitioner and the founder and practitioner at Arizona Healing Alternatives. On this channel, you'll find several videos, what I call aha moments or aha minutes, where we'll be covering topics that impact your health. Whether you decide to use Western medicine, alternative medicine, or something in between, I'm passionate about you knowing what your options are. If you enjoy the videos, please feel free to hit the subscribe button. For today's aha moment, we're going to look at how you pick out a practitioner. Whether it be a Western practitioner or an alternative practitioner, here are some things that you need to know to help you based on experience of that person, the rapport that they have with you, and then we'll also talk about gut reactions to help you make the best decision you can to find the practitioner you need to get on your path and your journey to health. So stay tuned. So if we first look at how to pick out a practitioner, well, of course, the first thing we want to know is we want to know what practitioner should we seek out. That's knowing what their discipline is and what they're doing. And we'll go into that in some further videos, but for today, let's cover just in general terms. How about experience? Well, that is a good thing to look at. When we look at experience, we're talking about, especially let's say, for example, you're going for a colonoscopy. If you're going for a colonoscopy, you certainly want to pick somebody who has had some experience doing that procedure several times and what their track record is in doing that. But not only that, let's talk about and break experience down just a little bit. I know for myself, when I graduated from nursing school in 1991, I chose to get a bachelor's degree in nursing. There are two different ways to become a nurse or a registered nurse. To become an RN, you can have a 2-year degree, and that's still true to this day, or you can go on and get a bachelor's degree in nursing, and then either way, you sit for your boards so that you can become a registered nurse. Well, ultimately, I chose to get a bachelor's degree the first time out, and when I graduated, what I noticed that the other nurses on the floor had a lot more hands-on experiences versus a lot of the book learning that I had. I really hadn't had a lot of hands-on experience at that time. So basically, I felt like I was kind of behind in doing actual physical skills. So ultimately, when I went back to become a nurse practitioner, what I found was that the place that I was working, they needed a nurse practitioner right away. And back then you could do a certificate program. A certificate program, they would send you for intense classroom time, about 4 months, and then you'd have 900 hours of actual experience where you would sit and you would actually get hands-on experience with patients. Well, back then as a nurse practitioner, you could do that. You could become certified and do that. With that, what happens nowadays is you have to get a master's degree or even a PhD to become a nurse practitioner, but somebody like me who was trained in 1994 and 95, they would have to do what's called grandfather us in so that we would practice exactly the same. You just have to have a different degree now that it's a different time frame. Well, ultimately, what I found going through as a nurse practitioner and not getting a master's degree or PhD was that when I graduated for my nurse practitioner, I'd had so much hands-on experience that I basically was really ready to go out of the gate when I sat for my boards to do that. So when we look at experience, also what I tell people is, does that mean, oh my gosh, you don't want to go to somebody who just has a ton of hands-on experience? Well, that's not necessarily the case, because what I found as far as knowledge goes was book learning is really, really good. From the standpoint that when I had a student by my side, which was almost every day in my nursing and nurse practitioner career, when I had that student sitting with me, it was wonderful because they were up to date on the latest research. And while I would go to continuing education conferences to learn and to stay up to date, they really were up to date on those things. And skills are something that can be learned along the way. So there's pluses and minuses. Now, of course, like I said, if I'm having someone do a colonoscopy, I would want them to have several years of experiences, doing that. So if we look at from experience and the things that you're looking for, we also want to look at the aspects of not only the training and how people are trained, but there are so many different disciplines these days where things are mixing. For example, you can go into a physical therapist and even get what's called dry needling, like with acupuncture tools. You can go into a massage therapist and have them do what's called cupping, which is a Chinese medicine treatment. So, and similarly, you can go in and you can see a physician, and sometimes they will also be a licensed acupuncturist. So, what's the difference with all of those things when it comes to experience? Well, ultimately, there are different ways of training, and that's something to really look into. For example, I know with physicians, specifically Western medicine physicians, oftentimes they can sit for their boards to become a licensed acupuncturist. They can do that after taking a few courses in that. That's different from somebody who has gone to what's literally a medical school for traditional Oriental medicine. That's a 4-year master's level degree, something that used to be called a doctor of Oriental medicine. So now they can't do that. It has to be a master's degree. So it gets really confusing to the public. I kind of liken it to when I was practicing as an obstetrics and gynecology nurse practitioner, and somebody would come in with an infection, and we changed the name of it about 3 or 4 times in the name of saying we know more about this infection. But honestly, sometimes it seems like we're just trying to confuse the public and trying to understand. I'm sure that's not really what's behind it, but it oftentimes seems much more confusing to the public. So similarly, how do you know when you go see a Western medicine physician that sticks in needles what their training is? Oftentimes they're trained in just feeling points that hurt and trained in how to put the needles, versus someone who's had that full 4-year degree in Oriental medicine or traditional Oriental medicine actually knows what's called channel theory and how to move the needle and things like this. So everyone has different training. It's the same thing as a massage therapist has their basic training, but when it comes to doing things like cupping, yes, a lot of people can do that, and that's not a problem, but are they understanding the exact placement? And every place has different ways of training. So these are things to ask. So it gets you a little bit about experience and training. Now, if we look at it, let's go into just rapport. When you walk into the room with that person, how does that person present to you? Now, I know some very brilliant surgeons that don't have the best rapport. However, I'm okay saying, I'm okay with the rapport because I know this person really knows what they're doing. All of these things, whether it comes from experience or this rapport, you have to decide what works best for you in the long run. So now when we go to the third option, we look at the gut level instinct. You've already done your research, so you've done the experience part and what that means to you and the different types of training and how that's done and how that makes you feel. So that's what I consider the intellectual part of it. And then what you're going to do is you're going to do how the feeling part of it. How does it feel when you're sitting with that person and that rapport? And then the last thing is that gut level instinct, which is also a feeling. I'm really, really encouraging people to trust their gut. You've heard the old expressions of just trust your gut, and it really comes out to be true. Once you've done your research and everything else, trust your gut into how you feel about the modality that you've picked for healing and also the person that you've picked. So today when we talked about it, we talked about what to look for. You're looking for the experience and what that means to you. You're looking for the rapport that you feel when you're with that person and that feeling in your gut. So if you enjoyed today and you've enjoyed this video, please feel free to hit the subscribe button. And then also when you hit that subscribe button, there's also going to be a little bell that comes up. That's a notification bell so that you can be notified if you like videos like this and you want more information. Thank you so much for listening and have a great day.